Public health officials are sounding the alarm about an increase in mental illness among youth. They say an already burgeoning crisis has been aggravated even more by the pandemic. In March, the Centers for Disease Control and Prevention released a survey showing 4 in 10 young people feel, quote, persistently sad and hopeless, and 1 in 5 say they have contemplated suicide. And joining us to talk about this and the state's effort to expand mental health service to youth in Illinois is Mashana Smith, clinical psychologist with Lurie Children's Hospital Center for Childhood Resilience. Thank you so much for joining us. First of all, what do you make of those CDC findings?
Well, obviously they're very alarming and very concerning. However, after studying this and being immersed in since the onset of the pandemic, I certainly think that there's validity and truth to the findings of the CDC. We've seen over the past couple of years a significant and disturbing rise in the number of children and adolescents who are in need of mental health care. My work in particular has allowed me to understand it both from the hospital perspective, where we've seen over a 50% increase, up to 8 times increase in the number of children who are both having calls in for intakes, as well as for those who are on our waiting list. So the list is very, very lengthy. Also, our work with school districts and with the Illinois State Board of Education here in the state has let us know that there is a crisis among children, and obviously that is affecting our school system heavily. Not only the way in which schools are feeling burdened and stressed, but the way it's impacting our educators as well. So, yeah, not surprising, unfortunately, that the circumstances of the pandemic have led to a significant increase in depression, anxiety, and yes, to the CDC's point, suicidal ideations, attempts, and unfortunately completions.
Clearly, from your clinical perspective, you're seeing this play out every day. Can we drill down on why the pandemic has exacerbated this problem to the degree it has?
Yes, absolutely. So we're seeing exacerbation for a number of reasons. One is the pandemic itself, I think, has led to a lot of social isolation, lack of social contact, which is incredibly important for children developmentally to advance. And so we're seeing lots of feelings of depression and loneliness, sadness, hopelessness. We've also seen a decrease in the past couple of years, in the reports of child abuse, for example, but we know that there's actually been an increase in child abuse in homes, and the children aren't able to have those safe havens or those safe places for people to report that danger that they're experiencing. So I think that may be contributing to it as well. Also, I mean, every source that we've seen have talked about the academic loss that's occurred. And that affects children's sense of competency and their beliefs in themselves too, right? And so that academic loss actually has some mental health impacts as well. So there are a number of reasons, not to mention the way in which the pandemic has affected economic outcomes, job availability, et cetera, all which has played into the stress that the families are experiencing. And that too impacts children and adolescents heavily.
Certainly so many interrelated problems here. Tell us about the state of Illinois program called REACH, which the state announced it's expanding now, and how that provides mental health service to youth.
Oh, absolutely. So happy to talk about REACH. REACH is an initiative that is in partnership with the Center for Childhood Resilience at Lurie Children's Hospital, where I am. And we're partnering with the Illinois State Board of Education to launch REACH, which stands for Resilience Education to Advance Community Healing. And this is something that actually was an outgrowth of the pandemic, recognizing the need that we were hearing from educators all across the state about the needs the children were presenting during that time. And that was when we were heavily remote. But even as we've transitioned back into school, educators have been extremely concerned about children's social and emotional well-being, but not only about children's social and emotional well-being, but their own and the toll that has taken on educators. So REACH is a program designed to really support educators in better understanding what is trauma and how it impacts children, as well as what is secondary trauma, how does it impact the adults who work with children, to provide that fundamental education, but then to move beyond that fundamental education to help them with different strategies and practices that can be useful in supporting children on multiple levels. First and foremost, creating a very trauma responsive culture and climate within the schools so that the policies and the practices take into consideration the different stressors and traumatic events that the children and students have experienced. And then moving beyond that, also making sure the supports are in place for students. So for schools who do not have those, beefing up their supports, their interventions that are available to support kids who may be in need of that. And then last but not least, really supporting students and families who may need more intensive supports outside of the school, and forming those relationships with community partners, whether that be a local hospital, a local community mental health center, et cetera. But across the continuum, making sure that the supports are available.
And this is getting the attention of the federal government now. The U.S. Surgeon General Vivek Murthy called into a local event to talk about his own struggles with mental illness. Let's just hear a little bit from that.
When I was younger, when I was in grade school, I struggled a lot with my mental health. I didn't have anyone to really talk to about it. Well, I did have people. My parents cared deeply about me. My sister did, but I was too, ashamed and embarrassed to really talk to them, much less to talk to any of my teachers or counselors in school about what I was struggling with.
So there's still a stigma here among youth, perhaps, that are afraid to seek help, and what they think that might mean for them. So what are the warning signs that parents and educators need to look for right now?
Oh, great question. So there are several warning signs. I would say the first and foremost, what you want to look for is a change in the usual activities, the routines, usual interests that your children may have. So if children are no longer interested in hanging with their friends or being a part of a club or organization that they used to be a part of, or just doing the things that they used to enjoy, then you want to pay attention to that. I think that's one of the strongest indicators. The other thing, though, is to keep in mind and look for whether or not they are isolating themselves in the family, not want to talk to anyone. Certainly look for signs of sadness, making sure that there are no signs of harm, like cutting, for example, or injuring oneself in any way. So those are all things that are very, very important to look for.
All right, a very important issue, and we will keep following it. Our thanks for now to Mashana Smith. Thank you so much for joining us.
Thank you for having me.